So, I think we're live. What do you think? Not yet? How would I know?
I'll tell you.
Oh,
Oh, so YouTube won't even let it go live till 3 since we scheduled it for 3.
okay.
Cool. So I'm on the feed, but it's still, it's just connecting now.
Okay.
We are, they're running the ad first. We're good?
We're live?
We're live?
Hello, world. Dr. Paul here. Thank you for joining me on another live stream. Today is Easter, and I just want to let you know if you are in the faith that celebrates Easter, I want to wish you the happiest of Easters. And for all the rest of the world, I just had this thought. It's not totally of my own because I just get a lot of input from the universe, but for all of us who are facing COVID-19, does that affect anybody in the world? Oh my word, it's just seemed to consuming everything. It's like the world is on pause. And so it sort of is fitting for those who do understand Easter that at the end of Easter, like today, there's an end to the pause, so to speak, and a new beginning. And I think for all of us, I wanted to plant this seed. When we come out of this COVID situation, which we will, in a lot of places we're peaking or we have peaked, and so we're looking at areas that have peaked. You're just a couple months away from being pretty safe, okay? It is coming. There is light at the end of the tunnel, and I'll talk more about COVID for sure. That's a huge interest of mine. But when we do, what will we do, right? Who are we going to be? How are we going to live our lives? And my hope for everyone who's watching is that you're going to live a more intentional, purpose-driven, reflective, authentic life. I mean, you will choose to be healthier. You will choose to make choices that empower your own physical health, your immune health. When you've been on pause for a while, and so many of us have been in isolation, it is a time to reflect. It is a time when you can start to say, what's really important to me? And when we get out of the pause, let's just not go back to that crazy busy life of, making a living at the expense of all else, and use what we've learned from this pause to cherish the things that matter to us. And so that would be what? Our family, our friends, our neighbors. You extend it as wide and as open as you can. So I am going to chat a little more about COVID, but I want to take a little moment to have my producer guide me on perhaps some advice I might want to give. Some of you know my son Noah. When he was little, we called him Nono. He produces this channel, and I'm so grateful for his guidance in doing that. And that's my lovely wife walking past in the background. Hi, wave if you're going to come into the screen there, honey. Anyway, what would you like to share?
So we have a super chat from CJ.
CJ, thank you.
CJ says, my son walks with his feet inward, and it causes him to trip and fall often. Is this something to be concerned about, or will it maybe get better with time?
So a gait where your feet are turned a little bit inward can be of generally two causes. If you think of my arm as your leg bone, this is the part of the leg that hits into the socket of your hip, so it's kind of like this. And if it's a little twisted in, right, then that can cause your feet to be turned in. The other is something called tibial torsion, where the tibia is slightly twisted. It depends on the severity. As a pediatrician for over 30 years, I've seen hundreds of kids like this, and not a single one has required surgery. So, without obviously evaluating your child in person, I can't be 100% sure, but I could probably say from experience, 99% sure there's nothing you're going to need to do. They may benefit from, excuse me, now, you're not supposed to touch your face with this COVID stuff going around, and I got an itch. First strike against me. I'm home. We're good. I'm gonna. Hi there, honey.
Don't be sorry.
I'm sure it'll be fine. But if it's extreme, by all means, take a consultation with somebody who understands kids, pediatrician, pediatric orthopedist, someone like that. So while we're waiting for some more questions, and we're going to get to them very quickly, I wanted to just give you a quick update on COVID-19. I have a book coming out this week. and it will be on Amazon Kindle, as well as there will be a mechanism for you to get it free. I just feel like the information that I want to present about COVID is so important that I want everybody to have this information, regardless of your ability to buy a book on Kindle or on Amazon. So there'll be a mechanism for that to be free as well. And that's coming soon. Those of you who are subscribed, stay tuned, and we'll get that information to you. In a nutshell, there's a lot of things you can do to prevent getting COVID. And secondly, if you get COVID, there are some natural approaches you can take that will absolutely boost your immune system and give you the best shot of successfully dealing with a COVID infection and not have to go to the hospital. So I had a dear friend end up in the hospital, and for that reason, I just wanted to write this book and get it out quick. So I think we have a super chat.
Just a regular question.
A regular question.
From
Which
Zainab Nasrullah.
Yes, Zainab.
She says, I'm a medical student. How did you get through medical school without giving up?
Oh my goodness. Medical school is so tough. The first 2 years for me were the worst. I was a biology major in college. I actually got a master's in biology, taught anatomy and physiology, then made it to med school. It was still the amount of knowledge they want you to sort of have in your brain is so immense. You just have to keep at it, keep at it, keep at it. Don't give up. Here's the thing. It gets better, especially if you love people. Once you get into the clinical rotations, it was, for me anyway, it was so much better. It just kept getting better and better and better. So give it your best and let go of the results. Something I learned way after medical school. I wished I'd learned it back then. The results would have been the same. I was so stressed because the amount of information seemed so overwhelming, and I didn't feel like I could retain enough. It was okay, and it'll probably be okay for you too. Just work hard, give it your best, and it's going to be what it's going to be anyway. You'll find your way through, and it will get better.
HM Loves Monkey says, I have a bad immune system. What can I do to help stay away from COVID-19?
So if you have an immune system that's challenged in any way, first of all, to avoid getting COVID-19, avoid having your hands touch your face. Anytime you leave your home, anything you have touched, you've got to assume it had COVID on it. And so you are not, now everything you touch, the doorknob to your car, the steering wheel, everything else, the bag you're carrying into the house, assume it has COVID on it. You walk into the house, you go straight to the sink, you wash, you backtrack your steps and wipe off the handles. Take it that seriously. Beyond that, you will probably be fine. It's not as airborne as they'd lead you to believe. Social distancing is important for sure in the height of an outbreak, but if you're taking care of that hand-to-face stuff, you're probably going to be just fine. But boost your immune system absolutely with vitamin D. If you are vitamin D deficient, you will have a relative weakness of your natural killer cells, the NK cells of your immune system, and they are the ones that fight COVID right off the bat before your immune system. This is a new virus we haven't seen. Vitamin C, high dose if you get infected. So D, C, N-acetylcysteine boosts glutathione, and a little bit of melatonin if you end up getting COVID. There's some specific reasons for why that's important as well. All of this information will be in the book that's coming out this week. Keep your eye out for that.
Super chat from Rachel Daig.
Thank you, Rachel.
My body is achy, but I have no fever. Do you think I'm going to be okay?
So body aches can be and are one of the symptoms of COVID. Do you have COVID? Probably not, unless you have a known exposure or you're living in an area where there's a ton of COVID. Then you have to, honestly, what I would do if that were the case, if you happen to be in a high-risk area, just assume you do and do the things I'm talking about. If I had COVID, I would take 5,000 IUs of vitamin D3 with K2 if you can find it with K2. Secondly, I would take vitamin C 1,000 milligrams as often as I could tolerate it. So if you take too much vitamin C, you get diarrhea. But if you can tolerate it, you can take it initially every couple hours, then every hour if you can tolerate that, even more often if you can. Some N-acetylcysteine and melatonin, a tiny dose, half a milligram to a milligram during the morning and lunchtime, and then 5 or 10 if you can tolerate it at night. And then I have a few other recommendations that will be in my book.
Super chat from M. King.
Thank you. Thank you, M. King.
From Millie.
From Millie.
My son is autistic and he walks on his tippy toes. What is the cause of this and what can be done?
So I have hundreds of kids in my practice who have autism, and God bless you, all of you parents who are dealing with children challenged in this way. When it's severe, it is especially challenging. At this time, my heart really goes out to folks when you're being told to quarantine and you lose all those services you may have been having. The tiptoe walking issue is an interesting one. We haven't figured out the why of how that happens. It's a sensory thing, I believe, mostly. And so if you happen to have access once we get clear of COVID to go see a OT, occupational therapist that deals with sensory integration issues, that can help. And then there are a number of supplements that can sort of help balance your immune system and be calming. I would definitely look at some magnesium. Calcium magnesium is related to muscle contractions and calming that down a little bit. That's a complicated one, though. It's a very good question, and thanks for asking that.
Super chat from Rose G.
Thank you, Rose G.
Hi, Dr. Paul. I'm 23 years old, and I recently diagnosed with GERD. I'm vegan, and I try to eat pretty healthy. I'm wondering if it will ever go away, or is this going to be chronic?
So GERD, gastroesophageal reflux disease. I actually have just recently been having some of that. It's where, I love fizzy water. I make my own fizzy water and I make it super fizzy, and lately it's been backing up a bit. That's GERD. People who experience that sort of acidity that comes up into your back of your throat or just right there. If it's starting to really affect your esophagus, you want to do things that might lower the acidity so you're not burning your esophagus. But if not, sometimes you can do some things naturally that will help this. The question about will you always have it? Not necessarily. So I would look to, mainstream medicine, MDs are basically doing ways of blocking acid. So whether it's an H2 blocker, and actually they've just had a huge recall on ranitidine, Zantac. They were finding some melamine in it. So I wouldn't go to that one. Maybe if you're going to do natural treatments that are over the counter, you start with Prilosec if you're trying to reduce acid. But you can change the flora in your intestinal system, and sometimes that can help GERD, and there's certain foods that aggravate it more than others. So definitely look into that. It's a great question, and I wish you the best. It should not be a huge deal. You'll find ways to conquer this.
Bridget, super chat from Bridget D.
Thank you, Bridget.
Bridget says, how did you and your son get started on YouTube?
So my son came to me about 8 years ago, I believe it was, and said, Dad, we got to get you on YouTube. He had just started his own channel maybe 6 months to a year earlier and was starting to have a little bit of success, and just thought, there's a lot of information that I have that's a little different than what other people are hearing from their doctors. And he says, we got to get you on YouTube. Oh, no, we're not doing that. I was so worried about the liability. Everybody tells you don't do anything online if you're a doctor. And speaking of liability, anything you hear or that I say here is purely informational. This channel is not intended in any way to diagnose or treat, and suggestions I may make are just what I would do if I was in a situation that might be similar to that situation that I'm told in a question. But yeah, this is not a doctor-patient consultation. It's purely informational. And it ended up being fun to do, and it ended up being received fairly well. And my gratitude goes out to you, the viewers, because it's this connection that we have that's made this possible and sort of given me the, that oomph to keep going, because I think we're making a difference. We can be impactful as a group of connected individuals if we have good information and we have a mechanism of sharing it.
Daisy says, how much vitamin C and vitamin D can I take if I'm pregnant?
So for pregnancy, vitamin D should not exceed 5,000 international units a day. So a lot of times your OB will say only take 1,000 or maybe at the most 2,000, but there are studies showing safety at 5,000 a day. So, and also there are studies showing benefit in pregnancy at that level. So I would shoot for 4,000 to 5,000 IUs a day of vitamin D3. And for vitamin C, unless I had COVID. So if I had COVID for sure and it was starting to affect me in a big way, I would up my C no matter what. But otherwise, I'd say 500 to 1,000 a couple times a day should be fine.
Super chat from Rich Renee.
Thank you, Rich Renee.
Is there a reason why my 10-month-old isn't responding to his name?
So we've got a 10-month-old not responding to their name. If they've never responded to anything, you would worry about their hearing. If it's just to their name, but they're responding to sound and light and noises, that's interesting. I think most important is, do you get eye contact, and does that eye contact track with you? So if you move, they're tracking. That's super reassuring if you're getting some tracking. If you're getting a smile in response to your smile, super reassuring. If they just don't get their name, but they're responding to sounds, I think it's fine. I mean, you know, I'm not evaluating them in person, so I can't be sure, but it's probably okay. If there's a loss of skills, by all means, once we've got access to, you know, consult with your physician for sure.
We've got a super chat from the Monacos, Emmett's Army.
Oh, the Monacos, thank you.
Just one question. How are you and Noah so awesome? Emmett says hi. Our family loves you too.
Well, we love your family too. You guys, this family has been through so much and is bringing to the world Hunter's Hope as an organization for newborn screening that will detect conditions that are missed on a lot of state newborn screening programs, and they are dedicating much of their lives to that. So kudos to you guys. Love you very much, and you've got one of the best families ever. Thank you.
We've got a super chat from Miriam.
Thank you, Miriam.
My baby has XYY syndrome. Do you know anything about this? Also, I followed the newborn through 4-month vaccine schedule. Going forward, can I follow your plan? He's 6 months old.
So, yes, I'm very familiar with the XYY. It's, I mean, it's not something we would go over here on this forum, right? But those are individuals who have that extra chromosome, and they can have specific challenges related to that, but actually can do quite well as well. So I would treat your child as normal as far as that goes. They don't need to know that, right? They're going to grow up as just who they are. All of us have genetic glitches. That one is just a very specific one, right? And there was a second part to the question, and I'm spacing on it. Sorry about that.
They followed a traditional.
Yes, on the vaccines. So this is certainly a format where I cannot go out publicly and say don't follow the CDC schedule. I might as well just right chop my head off or hand over my license. I do believe in informed consent, and that is a process that I think should be applied to vaccines, where you are told the risks and the benefits, and then you make a decision vaccine by vaccine whether it makes sense for your child in that circumstance. So, you know, can you switch from one schedule to another? Of course. You can go from none to all. You can go from all to none. You can do anything in between. So there's nothing that says, other than the CDC saying we have the best schedule. Of course, worldwide there are different schedules, and we can look at different results based on that as well. So yes, you can follow your own intuition and intelligence.
Super chat from Matilda.
Thank you, Matilda.
Between two of us, repeat the main part of each question if you can before you answer.
Okay. I've been asked to repeat the main part of the question. Sorry, because you're not hearing it well.
Dr. Paul and Noah, my daughter had hip dysplasia when born. Now, as an adult, she's complaining about hip discomfort. Is it HD or is she just getting old?
Gotcha. So hip dysplasia as a child and now older having some hip discomfort. Is it related to that hip dysplasia? Hip dysplasia as a child is this. Here's your acetabulum, the socket of your hip, and this is your femur bone, your leg bone, and it fits in there. If it's clunking around as an infant, then that socket kind of develops loose. It's not nice and tight. And so with a loose socket, you're going to strain your hip very easily as you grow older and have problems that are related to that. Hard to say, right? If the initial hip dysplasia did result in a slightly loose socket, it is probably related, and there's unfortunately not a whole lot you can do except just tighten all the muscles around your joint so that it's as tight and as strong as it can be. So I would say physical therapy, and obviously have it evaluated, see if there's any chronic degenerative issues going on. But hopefully it's not related, and it's just some aging things that you can deal with proper nutrition, anti-inflammatories, etc.
Super chat from CM Takaro.
Thank you, CM Takaro.
Is NK stim good to take as a preventative supplement?
So NK stim is not one that I have used personally. I am pretty certain that it's got some nutrients in there that stimulate the natural killer cells, which interestingly enough, that is something that's really, really important when you're fighting COVID, for example. So, provided the ingredients are appropriately dosed and they're safe, I can imagine that it would be fine. But sorry, I don't have personal experience with that particular supplement.
Super chat from Amputee Snoopy.
Thank you, Amputee Snoopy.
My daughter, 19, has not been able to sleep for the past 3 weeks. Insomnia, question mark? We've tried melatonin and 10 milligrams and sleepy time tea. Nothing seems to work. Any suggestions?
So, question about sleep. 19-year-old having trouble sleeping for the last 3 weeks. My best guess would be that it's related to stress. When we are inundated with this news about COVID and the sky is falling and look at all these people dying, and some of us have that tendency to sort of see the worst side of things and become fearful, and then we can't turn it off in our brain. So first thing is to realize that almost nobody, literally almost nobody that age, 19, has died in the world. I mean, a handful maybe, and they're almost always having underlying conditions. And I know the rare exceptions are put on the news, so it makes you feel like this could happen to you. Absolutely not. So you should have confidence if you're young and healthy that your risks are minuscule, and most likely you're being very careful, right? Because if you're the type of person who tends to worry about something like COVID-19, you're going to be extra careful. You're doubly, triply safe. So let's try to deal with the anxiety first and just understand that our dangers, our risks are minuscule. I mean, honestly, it's probably more dangerous to get in a car and drive to the grocery store. But there's also things you can do, right? Turn the news off, do some meditation, do some, exercise. It's always good to really work out at a level that gets you a sweat on. Eat healthy. Don't eat a whole bunch before bed. Turn off all your screens a couple hours before bed. And depending on how much melatonin she's taking, you could take up to 10 milligrams probably if you needed to, if you're taking way less than that. And just do a lot of these things that are just good for you. And I think you'll find that as the stress goes away, the sleep will return.
Super chat from Emma.
Thank you, Emma.
She says, my 4-month baby chokes mid-feeding, dozing off. Is this bad?
So a 4-month-old choking mid-feeding, that can be pretty common. If you think about most babies, they're whether they're nursing or you're using a bottle, they're sort of laying down. And so if you get full and you kind of get sleepy and relaxed, some of that, you stop swallowing, right? So you've got some milk pooling in the back of your throat, and a little bit can trickle down the trachea, which is your windpipe, and splutter, splutter, gasp, gasp, choke. You're not going to die from that. It's not bad or in the sense of being dangerous. If maybe your baby's falling asleep at the breast or on the bottle, just end that feeding. Or you kind of keep them awake until they're done and then call it good.
Super chat from Brianna.
Thank you, Brianna.
My 13-month-old had a hip click show up at birth and not seen again until 6 months. Ultrasound showed normal, but she has never done a traditional crawl, only an ape-like crawl. Do you think she's okay?
So hip clicks are fine, and if you've already had the x-ray, yes, she's going to be fine. This was a question about a hip click that was at birth and then not till 6 months, and then there's a different sort of crawl. It's not quite typical. I had a son who skipped crawling. I've had a few kids who've done odd crawls in my practice, and they've all ended up fine. So I think you've had it evaluated. Clicks are always fine. It's the clunks we worry about, and this is not medical advice, obviously, but just gut feeling from what you're telling me, you should be fine.
Elizabeth T says, how high are my risks for COVID since I have asthma?
So how high are your risks if you have asthma for COVID? I would say they're only slightly higher. Asthma is one of those situations where any infection of the lungs can trigger your asthma. And so obviously COVID is one of those infections where it seems to like the lungs. It replicates in your trachea and your pharynx, and then it can move down into the lungs. And if you're asthmatic, it's going to probably trigger asthma on top. So obviously that's not a great thing to happen, but I don't think inherently by being someone who gets asthma that you are more at risk. Asthma is an allergy thing. COVID is an infection thing. So I wouldn't worry that you're at greater risk, but obviously you're going to be a little more careful perhaps than somebody who doesn't have asthma, just because you know if you get an infection, and especially if infections tend to trigger bad asthma, that's not a good thing for you.
Super chat from AOME.
Thank you, AOME.
Dr. Paul, do you take medical students?
Do I take medical students? I have taken medical students a lot in my practice. What I do is I will use them as a scribe, and that way they're learning, they're in the room with me, but they're also doing my typing for me in the electronic medical record. So yes, I've done that a lot, but it always depends on the need at the time and the situation.
Let them know we're going to adjust the mic settings.
We're going to adjust mic settings. I'm coming through a little loud, am I? Not loud enough? Okay. We've put the mic settings up a little bit. Hopefully that helps. Thank you all for being on this live chat. I really do appreciate it.
Jess Ann says, have you ever diagnosed... Why did I even try? Sorry. Can you read that?
Where is it?
Jess?
Pheochromocytoma. So I know what it is. I have not had a case of that.
What is it?
So it's a tumor that's excreting too much adrenaline from the adrenal gland area around the kidney. Yeah, super rare, and so the answer is no. But yes, we learn about it in medical school, and I know what that is.
Ida Brown says, greetings from Ireland.
Greetings, Ida, to Ireland. How are you all doing there on this lovely day?
Oh, wow. Rob Rosen. My grandma overdosed on heroin and PCP. She passed away in a bathroom. Am I at risk for the same issue in addiction?
So, Rob, I'm so sorry to hear about your grandma overdosing from an addiction. I have an addiction clinic called Fair Start, and my main goal is to help young people, generally 30 and under, who are addicted to opiates, to help them wean themselves off of opiates. It is a passion of mine to help people in the addiction world, and so my heart goes out to all of you who may be suffering with addictions. Isolation is the worst thing ever, right? For people who struggle with addictions. Thankfully, there are online meetings galore, so get plugged in. As far as to specifics to your question, are you at risk? Yes. Those of us who have a family history have a higher risk of having addiction issues. But that doesn't mean you're going to have addiction problems. So I didn't realize that I had risk for addiction or alcoholism at all. When I grew up, I was a missionary kid in Africa, and my parents didn't drink. I knew no one who drank, and I ended up an alcoholic. I drank a lot at the end of my drinking career, which was 17 years ago, when I realized I was way overdoing it, and it needed to stop because it was bad. And thankfully, I'm a recovered, in recovery, alcoholic. And I'm vigilant about it because I saw where I went, and I don't want to go there ever again. Right? So some of us, I wrote the book, The Addiction Spectrum, to deal with this because addiction happens on a spectrum of illness. If you have risk factors, and let's say you're just occasionally having a drink, you may be just fine. But if it's gotten to close to daily, or you're doing a lot of binge drinking, you're getting into that severe level of the spectrum, and you may want to stop while you can, kind of thing. So you could take a look at that book, The Addiction Spectrum, but no, you're not doomed. If you never drink, you obviously will never become an alcoholic. If you never take a particular drug, you'll never become addicted to it. So you have risk factors, but that doesn't determine your destiny.
Maja says, is a person at high risk if they already got corona?
Is a person at high risk if they only got corona?
Already had it.
If they've already had it. So this is the $1 million question, right? A lot of people have had COVID, and the thing is, we don't know who they are because so many had either no symptoms or very mild symptoms. They talk about 80% of people having mild symptoms or no symptoms at all. They are just coming out. I just got access to a test that tests IgG and IgM antibodies against COVID. So we're going to start testing in my office. I'm going to start with my clinical staff, the nurses and doctors, and see how many of us are already immune. Because if you're already immune, the chances that you get it again are extremely low. That's the beauty of natural immunity. And we just don't have enough of those tests being done to have any idea what percentage of the population is actually already immune. My hope is that we're going to do a massive amount of IgG and IgM testing, especially the IgG down the road. IgM you get right away, IgG later, and then we'll know how many of us are still at risk after this is over.
Super chat from Lindsay with no question.
Oh, thank you, Lindsay. Appreciate it.
We got a super chat from Kondapali. Says,
Thank you, Kondapali.
My wife diagnosed with spinal TB recently, and my baby is 4 months old, and we suspect the infection is in her body from start of pregnancy. How does it affect my baby?
Well, that's a tough question. Tuberculosis, sounds like mom had spinal tuberculosis and worried about baby having TB as well. Clearly get this treated. There are treatments for tuberculosis, and it generally is infectious when you have the tuberculosis infection in your lungs and you're exposed to someone who's coughing. But it's absolutely something you want to treat. Absolutely. I'm sorry to hear that you're going through that, but you can get through this. Absolutely.
Rachel, super chat.
Thank you, Rachel.
I am also a diabetic. That's why I'm so worried about this COVID stuff. I have extreme anxiety. I'm on Zoloft. I've tried hydroxyzine. Nothing is working.
Okay, so diabetes and anxiety and worried about COVID. My co-producer is saying, you know, we've got what's the best link for Douglas? Healingfromdepression.com. I've read his book, Douglas Block. He is a master at guiding you through depression and anxiety. He's dealt with it himself, written several books, but a really good one on that. And so definitely that's a resource. But here's what I would say. Diabetes, for sure, we know that puts you at higher risk. But you're not at higher risk if you don't get infected. So absolutely, all you need to do is keep your hands from your face, okay? And if you're out in public, especially indoor, I'm not so worried about outdoor. Sure, keep that distance, that's wise. But indoors, you know, wear a good mask, keep that social distancing when you're indoors, and just assume that anything you've touched may have COVID on it, and you're not going to put it to your face. You're going to wash your hands a lot, and as soon as you get home, and even the stuff you bring into the house, assume it might have COVID, and you'll be fine. It really is totally avoidable. I saw an ER doc who was in the midst of treating patients, and he wasn't worried either because he was taking those precautions.
Super chat from Ashley.
Thank you, Ashley.
I had a baby 4 months ago. I have upper back pain and chest tightness. Can it be a muscle strain from always holding him or a vitamin deficiency?
Have a 4-month-old baby, congratulations, and having some upper back pain and stuff. Chest tightness. Well, obviously in the era of COVID, chest tightness can be a symptom, but it's probably not that. I mean, I would say go with common things being common, and you're holding a baby. First of all, carrying a baby for 9 months is really hard on a body, and then going through labor and delivery, and then now you're carrying this baby a lot and putting, you know, it just puts a strain. And once your back is strained, it doesn't take much to keep aggravating that. So I'd say once you can get access to a massage, physical therapy, that's where I would start for sure, and that might solve the problem.
Mario asks, have you ever had any case of precocious puberty? How is it diagnosed? Gotcha.
So Mario is asking if we've ever had cases of precocious puberty. Absolutely. So precocious puberty is where you start puberty too soon. The interesting thing is they now say for African American girls, puberty can start at age 6 and be normal. Puberty in girls starts with the breast buds, and then you develop a little pubic hair, and then it goes on from there. In boys, it's your little bit of hair, testicles grow, and then your growth spurt. Here's the thing. if you have a really early onset of puberty, and if it's a normal sequence, but it's just early, but it falls in that normal range, it's probably okay. What you can have are cases where the pituitary, which is up in our brain, I can't point on the camera, is excreting too many hormones that are overstimulating ovaries in the case of females, testicles in the case of males, the adrenals, and you're starting to kick out the hormones that put you into puberty at a very young age. That is something that needs to be dealt with because it could be a tumor. Those are extraordinarily rare. I think I've had one, maybe two in my entire career. I've been doing pediatrics for over 30 years. So usually it's just a normal variation, and there's a lot of reasons that we're seeing puberty earlier and earlier, but something to definitely look at if it happens to your child.
Alicia Perez says, I've been on Suboxone for 10 years and I don't want to take it anymore. I'm tired of it and I'm strong now. What are your feelings on this?
Alicia, a topic dear to my heart. On Suboxone for 10 years. I'm an addictionologist. I'm board certified in addiction medicine. Obviously, I'm not giving medical advice on this channel, but what I do in my practice is I encourage people to wean very slowly off of their Suboxone or their buprenorphine. Suboxone, buprenorphine, it's a partial agonist, partial antagonist. So here's what it does. It's like half-strength opiates, but it also blocks half the opiate receptors. And the beauty of that is if you're an opiate person who's been using opiates long-term, there is no way to overdose on this medication because it's half strength and half your receptors are blocked. And that's a beautiful thing. If you wean down very slowly, you can get to such a low dose that you can eventually get off of it. And those slow, stepwise weaning of your dose are much more manageable than trying to go cold turkey. Getting off of Suboxone cold turkey is probably harder than getting off of heroin. So I generally take people from 16 to 14 to 12 to 10 to 8 to 6 to 5, 4, 3, 2, 1.5, 1 half every other day and then off. And you can't do those changes any faster than 2 to 4 weeks. So you can imagine if you're starting at 16 milligrams, that's going to take you at least a year. But you get on the journey and you make sure you're strong emotionally, physically, and you've got your social network. You're plugged in. You don't want to be going through the slight distress that happens as you lower your dose. There's just some angst. It's just you feel a little tired. You don't have your same energy, and that can be triggering for people, and you don't want to relapse. So yes, work on it with the guidance of a professional, and do it when you're strong as you say you are, and then don't push it if you're having a weak moment. Get plugged into your support system. Use your tools.
We've got a $20 super chat from Crypto.
Thank you, Crypto. Crypto Chris. All right.
You do virtual appointments. Thank you for everything you do. Absolutely love your book, The Addiction Spectrum.
Thank you for reading The Addiction Spectrum. And I am not set up for virtual appointments at this time. I've considered it at various times. There may be coming a mechanism to do more of an informational, educational consultation. We're looking into that option, so stay tuned. Regrettably, I wish I could, but I've not been able to navigate the virtual appointment with all the other things I'm doing in my life. Appreciate the support, though. Thank you, and for reading the book, and I wish you the very best. Absolutely. Stay strong, use your tools, and keep plugged in. Stay plugged in to people who are doing the right things.
Bidgie says, we love you.
Thank you, Bidgie. Love you guys too for checking in.
Why don't you go ahead and just re-talk about your book coming out on Corona for new people that are checking in. Then you'll be sending it out free and you'll be on the lookout for that.
Okay, so my producer wants me to just remind you, you may have joined us since I started at the very beginning. I was telling viewers that I have just finished a book on COVID-19. I was motivated to do this by a dear friend who ended up in the hospital 3 weeks ago and basically almost died. I mean, he was right there for several days, needing to be intubated. He refused. He hung in there. He fought through it, and he just got home a few days ago, and he's going to make it. He's going to be okay. But what just distressed me to no end was this was a good friend, fairly good friend, who got to the hospital and put in isolation before I knew, and by the time you're isolated, there's nothing you can do. His wife couldn't visit him, I couldn't visit him, I couldn't direct any of his care, and he almost died. And people are having this experience with COVID-19 all over the world and being just whisked away from their loved ones. And I really believe there are things you can do to first prevent getting the infection, but secondly, if you get it, there are absolutely things you can do. And I'll talk about this in my book. It's coming out for free. It's also going to be available on Amazon. I'm putting it out on Kindle. That should be by the end of the week. So you'll be able to get an ebook or an actual paperback on Kindle. And I'm going to be giving away just free links in the very near future, in the next few days. So just stay tuned. It's coming. Share it with everybody you care about. And I mostly hope you will actually do some of the action steps I tell you. Some simple things like taking vitamin D, vitamin C, melatonin, N-acetylcysteine. You'll learn more in the book about exactly what to do, how to do it. It's simple stuff that you can just get at the corner store if they still have it. And I'll also give you links to get discounts on stuff like that. So just something that I'm passionate about right now, given just the drama about COVID that's going on in the world, which, by the way, in most places it's peaking or almost about to peak, which means the light is at the end of the tunnel. You can see in almost every place that they have a huge outbreak. Once it starts peaking, you're just a couple months away from being, I'm pretty sure, okay, right? So don't give up, hang in there, and turn off the news. It's just, I can tell you what it's going to say until it doesn't say that anymore, and that is that there's more cases, more deaths. Okay, hello. They're way exaggerating the deaths. I'm not trying to minimize this. This is a bad thing. It's a rough disease, but it's not as bad as they're making it sound to be.
Mom to 3 with a super chat.
Mom to 3, thank you.
Daughter retracts when breathing since birth. Doesn't struggle to breathe, but she does get wheezy when she's sick, but otherwise she's healthy. What could cause this?
So we've got a little one who's retracting. That is probably the ribs are showing with breathing, and this has happened since birth. I will say this, there's a very common thing called tracheomalacia where your trachea is a little floppy. It is a little floppy in all babies, but sometimes more than others. And so when they're on their backs especially, you can get a kind of a noisy, rattly breathing that sounds like they're in trouble. Every baby outgrows that, so if there's some of that along with what you're seeing as retractions, it might look worse than it is. However, if there's an apparent air hunger, that needs to be evaluated. My guess is that's not the case because you didn't exactly mention that, but retractions are where the ribs show up with each breath, because as you're taking deep breaths, you can kind of see the ribs appear, and it's usually a sign that someone's struggling for air. And if that's going on, obviously you need to be evaluated. You can now get a pulse oximeter, these little boxes that just fit on your finger, and you can see what your oxygenation is. That might be a tool to consider, because if your oxygen's in the mid to high 90s, you're perfectly fine. And you may just have a slim baby that's the way they look when they breathe. Again, not giving medical advice on this platform, and if you're worried at all, see your medical provider.
Super chat from Stephanie.
Thank you, Stephanie.
Is it okay to prolong immunization for children at this time?
So that's a very good question. Immunizations in general is it okay to prolong immunizations at this time? So it's very interesting. I wrote the book, The Vaccine Friendly Plan, which gives a different way that one could consider to vaccinate in a relatively safe way. The CDC schedule is the recommended schedule. And it's interesting to see the Academy of Pediatrics and even the CDC wrestling with this issue. So you're being told, don't go to the doctor's office because you'll expose yourself to COVID or potentially expose yourself. Oh, but wait a minute, you've got to go to the doctor's office to get your vaccines. And so they've gone back and forth on what you should do. Honestly, my personal opinion, right, this is not medical advice, this is just what I would do with my child. No way am I taking my child in to get a vaccine for something that's super low risk and take a chance of getting exposed to something that's way higher risk, right? The risk is pretty low for kids though, you guys, actually. But nevertheless, in the time of the major outbreak where you live, why would you go into a doctor's office, which is one of the riskiest places, I mean the ER would be worse, at a time when you don't want to be exposed, right? You're being told to stay home. So I think a lot of doctors, even those who really push the CDC schedule all the way, all the time, are allowing patients to just wait. We'll get you caught up in a bit once this passes. I think that's totally reasonable.
Question for me, your son. What's your deepest, darkest fear?
A question from my son. What's your deepest, darkest fear? You know what I'm most afraid of? I'll just tell you straight up. We are being programmed to feel like this COVID thing is so scary that we have to have a vaccine to survive. And honestly, I'm not sure that's the truth, okay? We need more data. We need more information. And it just does scare me that the world is looking for a savior at the end of a needle. When some of the prior vaccine research that's been done for coronavirus vaccines has shown that people who get exposed later, or the animals that got exposed later, actually died. They did way worse. Okay, there is something going on with this particular virus that a vaccine might be a very bad idea. So we need long-term studies. We need placebo-controlled studies. And when I say long-term, we're talking at least a couple years. We need to get through a couple seasons of COVID to know that by vaccinating, you're actually going to have better outcomes, not worse outcomes. And I touch on that in my book that'll be coming out for free very soon, or you can get it on Amazon. Keep an eye out for that.
Super chat from Lindsay.
Thank you, Lindsay.
Has the AAP released any data on COVID-19?
AAP, Academy of Pediatrics, I'm guessing you're referring to. Has it released any data on COVID-19? No, the data that everybody's using is coming out of CDC, WHO. Johns Hopkins has a great website for looking at the world data. And yeah, I think they're totally relying on that. There's an interesting little aside. While the news is going, all of this is happening, like the sky is falling, I have a friend who works in one of our big trauma hospitals here, and it's like, twice I've asked her, are you guys busy? She said, no, it's weird. It's like a ghost town. Same is true for the major hospital that I'm closely affiliated with. There's very little going on. So OHSU, our big regional trauma center and hospital where all Oregonians from around the state get referred to, has had 6 cases at the last weekend at the height, supposed height of our outbreak. Interesting, right? So, anyway.
Oh boy, I was trying to avoid this question that someone paid. I just don't know if Valerie, super chat.
Hey, Valerie.
I've been following Dr. Ken Berry. What's your opinion on the carnivore diet?
My opinion on the carnivore diet. So, I have not read Ken Berry's carnivore diet specifically, but there's pros and cons to paleo, to eating very extreme on one end or the other, as far as the risks and benefits. Here's the thing: if you are obese and you're eating a SAD diet, the standard American diet, which is a ton of carbs, a ton of sugar, a ton of processed foods, and you're just blowing up with obesity, and you went on a carnivore diet, you would probably lose weight and have lower risk, right? But one of the other issues is if you're just eating a lot of top of the food chain food, right, meat, you're also ingesting a lot of toxins compared to eating, say, a lot of fruits and vegetables. And there are nutrients in fruits and vegetables that you don't get from just eating meat. I'm just assuming if the carnivore diet excludes or largely excludes fruits and vegetables, you'd get in trouble. It's just animal? Yeah, I think you're going to get in trouble if you're just eating animals. I don't think we were, metabolically, there's so many pathways that need other nutrients that you're not going to get just from eating meat. Yeah. So another thing is, if you're going to eat the whole animal, you got to eat the organs, you got to eat the bone marrow, you got to eat a lot of different things to get all those other nutrients. And, if you've got a lot of money and you can have yummy steaks, you're going to get marbled steak, man. It's like, woohoo, party. You're going to miss some other nutrients, though.
All right. JCM says, are you as a doctor in quarantine or are you still working?
Am I as a doctor in quarantine or am I still working? No, I am still working. So Here's why. I'm a pediatrician with a large practice. I have babies every week. We get about 30, 35 babies a month in my practice. Babies right after birth need to be seen. There are a couple reasons. It's a delicate time of making sure they're not getting too jaundiced to the point where it can cause brain damage, something called kernicterus, making sure they're not losing so much weight. We got to get breastfeeding going, or if it's not going well enough, supplementing. And so the jaundice, breastfeeding, weight gain thing is critical in the newborn period, and we've got to do some newborn screening. So for those two reasons, I want to get those babies plugged in and seen actually physically, not virtually. You can't virtually take a blood draw to do a newborn screen. Secondly, when people are super sick, do you want them to go to the emergency room where there's a super high risk of COVID exposure, or come to my office where we haven't had a single case, right? So we can take all the same precautions that an emergency room can take. We can mask up, put on our gloves, and be very careful, but it's a much safer environment. So yes, we're open. We are doing mostly virtual visits to minimize the volume of patients. And I happen to have in my office a well and a sick waiting room, and I'm also separating the areas of the office to the best of my ability. So, and first part of the day is just well kids, no sick kids allowed at all. So we're doing everything possible so that there's virtually no chance you're going to get exposed while you're at my office.
Did you answer the question, do you have any patients with
Neurofibromatosis? No, I don't think you asked that.
We have a super chat from Jess.
Hi, Jess.
Do you have any patients with NF? I have it. How common is it?
So do I have patients with NF? I'm thinking you're referring to neurofibromatosis. Yes, I have a couple. It's not very common. We could Google that and get the stat for it. I don't want to hazard a guess. It's probably more common than I would guess, but it's not something I've seen much of. And yeah.
Fewer than 200,000 cases in the U.S. each year. Rare.
Fewer than 200,000?
Per year, yeah.
200,000, yeah. Pretty rare. Yep.
Timon says, greetings from Belgium.
Hey, Timon from Belgium. I just saw in the news that Belgium and Germany are, I think, doing the best economically throughout this hardship, so they're struggling with how to rescue the rest of Europe.
Gordon says, hi, Dr. Paul.
Hey, Gordon.
Paula Delgado says, Dr. Paul, what would be the best vegetable or fruit should I first introduce to my baby after her pediatrician approves?
Hi, Paula. First vegetable or fruit to introduce to your baby after your pediatrician approves. Well, yeah, I like that. Check with your pediatrician. That's always good. You know, a lot of people will do carrots. I think squash is good. I think, you know, some people even go avocado. You can probably, you know, the teaching that we were taught was one new thing at a time. You know, I think back to growing up in Africa as I did, and, you know, you just fed kids what you had, right? I mean, they didn't have blenders or anything, so sometimes parents would chew it up for their little baby. Oh my goodness, don't do that right now with COVID around and what have you. But honestly, yeah, if you're starting with good, fresh, organic produce especially, you can probably get away with almost anything. That's not standard pediatric advice, so do check with your pediatrician. And the simpler it is, the more digestible it is, right?
This is a tough one. Jellybean Jilly.
Hi, Jellybean.
I'm a trans male, and due to the outbreak for appointments, stuff like puberty blockers have been canceled. Any tips for how I can deal with the negative feelings that come with delays of my treatment?
So, trans male and can't get his treatments. You know, my heart goes out to you and to anybody who's sort of in this position where, because of the total shutdown of what they call non-essential services, people are suffering without treatments of all kinds. And I guess, wow, you know, do your best to accept what you can't change, right? I mean, this is there's something called the Serenity Prayer that we learn when we're in the recovery side of things, people who know addiction. The serenity to accept the things you cannot change, change the things you can, and the wisdom to know the difference is basically it. And if you fight what you can't change, you just get frustrated, and like you're probably experiencing some depression over that. This is just for a time, and it will pass, and you can get back to doing what you need to do, and then hopefully there's a way to sort of protect yourself in the future so you can be a little less. Check with your physicians. Can't they do something online for you? I wonder about that. I mean, people are doing remote visits online and able to do prescriptions even without seeing you, seems like you might have a real legitimate need. But yeah, do everything you can to make sure there's not something you've overlooked, that you might be able to have access to the medications you need for sure. And otherwise, my heart goes out to you.
We have a super chat from Werner.
Thank you, Werner.
Just says thank you for all you're doing.
Thank you for support. Appreciate it. Did I just see Zimbabwe go across this?
Yes, I'm trying to find it again.
Hey, Zimbabwe. I grew up in Zimbabwe.
Yeah, it's funny you said that. I literally highlighted it within the super chat.
So
Nindy wants to know if you have any plans on going back to Zimbabwe.
Plans to go back. I went back in 2009. I don't know that I'm going to make it back. It's tough. I was just talking to my brother Farai Rukunda, who has a nonprofit in Zimbabwe, and he was talking to me about his worries for COVID come when it's winter there, right, which is coming up. And so I was sharing with him that those of you who are in parts of the world where maybe you don't have as much access to health care, that number one thing to do right now is get out in the sun with your shirt off if you can, right? If you're a woman, obviously you're going to probably take that advice with some proper attire. But sunlight hitting the skin is how you make vitamin D. And so vitamin D deficiency is probably the number one thing that's putting those who have darker skin at greater risk. So in America, we now know, this has just been all over the news the last 24, 48 hours, that our African American community is suffering at a much greater rate than the lighter skinned people. And here's the thing. Vitamin D is critical for a natural killer, those NK cells, to function. And that's your first line of defense against a virus for which the body has never seen. Because it's the natural killer cells that attack. They don't need an antigen. They don't need an antibody. They just go to work on the virus that's there. And so vitamin D deficiency puts you at great risk. If you can take extra vitamin D, by all means do, up to 5,000 IUs a day for adults. But if you don't have access to that, get sun. I mean, get as much sun as you can without getting a sunburn, and that will boost your vitamin D status and get you ready for the winter that's coming in the southern hemisphere, where it's quite likely the COVID outbreak is going to move from northern hemisphere to southern hemisphere over the next couple months.
Kiana Carmack says, when do you predict the social distancing measures will be relaxed and things start opening up again?
So I think that's going to be country by country, city by city. It's probably going to happen and should happen about 2 months after the illness peaks, wherever you are. I think it could potentially happen sooner, but I don't think it will. Nobody wants to be that governor or that official that relax social distancing and then have an outbreak explode again. So it's a really tough decision, but if you look at how the curves go, by the time you're 2 months from the peak, certainly 3 months from the peak, I would think they should be relaxing social distancing big time. It's just nobody wants to be that official that did that too soon, right? Because with this particular outbreak, it has seemed like the more aggressive people were about quarantine and social distancing, the better the outcomes. And so we're going to have the flip side where nobody wants to undo it. But it's coming. I expect in the northern hemisphere in a couple, 2-3 months, most places should be back to some semblance of normal. But the fear of crowds, I'm wondering what's going to happen with things like sporting events. You just wonder. There's just going to be a lot of fear, and we'll see.
Shout out to Elaine Bartram.
Shout out to Elaine Bartram. Thank you.
Blythe asks, hi, Dr. Paul. I have to fly across provinces for my job at the end of the month, and I'm concerned about contracting COVID. Do Do you have any recommendations for preventative measures or for airports or for flying?
So if you have to fly during these times where COVID is still fairly active in different areas that you might be moving through, if you can get yourself an N95 mask, I know we're supposed to reserve those for the frontline healthcare workers. That would give you a better level of protection from breathing things in. Also remember, however, that it's touching things. So I would get gloves and then make sure you don't touch your face, and make sure that you are aware that everything you have touched with your gloves now are covered with COVID. So when you take those off, you still wash your hands, but if you touched your suitcase with those gloves, you've got COVID on your suitcase handles. So you're going to have wipes to wipe all that stuff down, and just be that careful and you'll probably be fine. It's not as airborne as people make it out to be.
Say hi, Eden.
Hi, Eden.
This comes up from a lot of different people, so we'll touch on it one more time. Love Lego says, what would you do if you had severe asthma?
So several of you are worried about what to do if you have severe asthma. First of all, make sure you have your inhalers, right? You need your rescue inhaler, your albuterol, and your steroid inhaler, so that the inflammation that would develop when you have an asthma attack, you've got the tools you need to manage that. And then beyond that, you just have to be extra careful, right? Whether you have underlying heart disease, lung disease, kidney disease, diabetes, high blood pressure, if you're on ACE inhibitors or angiotensin 2 blockers, those drugs that we're worried about, you need to be extra careful to make sure you're not exposing yourself to COVID. Okay, we're going to do 10 minutes more and call it a wrap for today. Really thank you all for tuning in. You guys have been great questions. And do be on the lookout for my book. Like I said, it's going to be on Amazon. It's COVID-19. I got a really cool title. The rest of it I can't remember off the top of my head. I put this thing together fast in the last 3 weeks. Wrote a book that normally should have taken me 6 to 9 months. So it's not going to be perfect, but I think it's going to be important. And it will be available for free. It will be available also on Amazon Kindle, in a ebook and in a paperback. We're scrambling right now to get all the code right so we can put it into paperback.
Good Lies has a question. Dr. Paul, I think I might have a kidney infection, but the doctor's office is closed. I don't really want to go to the hospital. Is this something I can treat from home?
Possible kidney infection, and you're wondering if you can treat it from home. Well, if you have fever and pain in the flank area of your back, no, you need to be diagnosed and get on antibiotics for sure. Right? That's a pyelonephritis, that level of kidney infection you don't want to mess around with. If it might just be a bladder infection, I believe in some pharmacies you can now get urine dipsticks, and you can see if you have 2+ white cells plus nitrite positive, that's a bladder infection. Sometimes you can flush those out by just massive fluids. Cranberry juice helps. As long as you don't have fever and you can flush it out, you might get away with that. And give your doctor a call, though. They may have an approach for you to manage this without bringing you in.
Dr. Torrance says, how are you doing today, Dr. Paul?
Hi, Dr. Torrance. I'm doing great today. I'm in my living room. The windows are open. The breeze is blowing by. The sun is shining. The sky is blue. The birds are chirping, and the everything's blooming. It's amazing.
Tartan Spartan says, do you ever use probiotics to boost immune health? If so, which ones?
So do I use probiotics to boost immunity, and if so, which ones? Absolutely. So I don't personally love fermented foods, and I don't do my own fermenting, which would be a great idea. If you know how to do that, do it. Eating natural fermented foods is the best way to get those healthy, normal bacteria into your gut. But if you need to replace with probiotics, I use several different ones. HMF Neuro is one I like real well from Genestra. Claire Labs makes great probiotics. Metagenics makes a great probiotic. There's a new spore-forming probiotic that's made by, oh dear. And actually, my producer's better at remembering stuff than I am. If you would like a 25% professional discount on all your supplements, including probiotics, there is a Wellevate link in the description, and I pass on that 25% discount, professional discount. So take advantage of that. Just log on, make yourself an account, and shop around. Just put in probiotics. You'll find Wellevate contracts directly with all the major reputable brands in America or in North America. So you don't get onto Wellevate just because you have a supplement. You have to go through a rigorous process. And so most professionals who recommend supplements are using Wellevate because the vetting has been done for which companies are actually making legit stuff or good supplements. The other thing about if you buy your supplements on some mass online places, the quality control is not there. So you may not get what you think you're getting.
Caitlin says, does hand sanitizer kill coronavirus?
Does hand sanitizer kill coronavirus? I believe it goes a long way, right? Alcohol-based, I've read that it has to be at least 70% alcohol to kill the coronavirus. So there are a lot of people making that. Soap and water works great. Usually you want to be washing your hands for at least 20 seconds with soap and water. And that's like getting in between your fingers, front and back, this sort of thing. And then rinsing real carefully. If you're out in public, you use your paper towel to then turn off the water so you don't go back to touching the faucet where there might be virus. You've just washed your hands. But yeah, hand sanitizer is better than nothing, that's for sure. And soap and water is the way I go, or gloves. 5 minutes to go, folks. Thank you again for tuning in. It's Easter Sunday. I just wish for you that you can find peace regardless of what's going on around you. Find it within. Find a time to quiet yourself. Turn off the noise. Turn off the news. Remember what's important. Our loved ones. We're going to be okay. And really, let's just embrace the quiet that we have at this time, because that hustle bustle is coming back. It's going to come back with a vengeance. And we're craving it, right? Some of us. But let's remember sort of what's important as we move out of this crisis, and maybe take with us some of the good that we've learned from having a little downtime.
Super chat from Kathy.
Thank you, Kathy.
Hi, Dr. Paul. My 3-month-old formula-fed granddaughter has a difficult time pooping. The doctor recommended prune juice. What are your thoughts on this?
3-month-old formula-fed having trouble pooping. Doctor recommended prune juice. I'm actually okay with that. We don't usually start any foods until 4 months. So 3 months is a bit early. That would not be a standard recommendation. But boy, prunes work. So that probably would work. The other thing to think about is there are some situations, actually it's very common, where one formula is very constipating, but another one would not be. So switching up the formulas might be worth trying. There's one brand that only has whey protein, no casein, and I found that brand sometimes works better if you're constipated by the casein that's in most of the other cow milk-based formulas. I'm not a huge fan of soy. If you're going to try soy, it tends to be just as constipating, and if you're going to try soy, it's got to be organic. Mass-produced soy fields are glyphosate-ridden, and you don't want that in your body. There are definitely some elemental formulas that would probably be less constipating, but they're expensive and they don't taste good.
You can give us final thoughts if you want, or just say bye.
So I'm going to sign off for today, you guys. Happy Easter for those of you who celebrate that holiday. And for the entire world that's watching, thank you for tuning in. I'm Dr. Paul. I look forward to sharing my book on COVID with you this coming week. And feel free to share it widely when you get it. And do some action steps so you are empowered. The fear that most people have is because we're feeling helpless, right? This big, bad, scary thing you can't see is out there that might get you. No. We know what to do, no hands to face. And with my book, you're going to learn the key few supplements you need to have in your house that you take when you need to, and what to do if you get sick so that it's not going to take you to the hospital. And once empowered, you don't have to have fear. So we can be fearless, we can be warriors, and we can move forward with confidence that we're going to be fine. We're going to survive this thing, and we're going to survive it together. Again, Dr. Paul, thanks for watching. Bye-bye.